Good morning. This is the Iowa team, and we are here to talk about our statewide implementation of AWHONN post-birth warning signs. Next slide. I'm Stephanie Trusty. I'm a nurse, and I work for the Iowa Department of Public Health. And part of my responsibilities is the HRSA Maternal Health Innovation Program. Dr. Radke?
And my name is Stephanie Radke. I am an obstetrician gynecologist. I practice at the University of Iowa Hospitals and Clinics. I also serve as the Quality and Safety Officer for the Iowa section of ACOG, and I'm one of the co-investigators on our HRSA award. Steph and I are both members of the leadership team for our new Maternal Quality Collaborative here in Iowa, which has sponsored this initiative.
Next slide. So we just want to acknowledge that our time to do this presentation is part of our HRSA State Maternal Health Innovation Program, and our award is listed on this slide. Next slide. So as part of our project, one of the things we wanted to showcase is really this project was identified by both our Maternal Mortality Review Committee and our IMQCC as ways that we could take the outcomes from our maternal mortality review, the data we identified, and put that into action by providing education to help reduce postpartum deaths. We selected AWHONN's post-birth warning signs to help with a standardized education, and we're going to talk about that program in this presentation. Next slide. So actual data from Iowa's Maternal Mortality Review Committee report, we at our last review did a 3-year review from the middle of 2015 calendar year through the middle of 2018 calendar year. And that report showed that 56% of Iowa maternal deaths were postpartum. The leading causes of those deaths were cardiac and hemorrhage, and other causes included preeclampsia, pulmonary embolism, pneumonia, and infection. Next slide. So I did just briefly want to talk a bit about AWHONN. I didn't want to assume that everyone watching the video will know who AWHONN is, and they did develop the training program that we selected to implement statewide. AWHONN is the Association of Women's Health, Obstetrical and Neonatal Nurses. It's a professional nursing organization with a mission to empower and support nurses caring for women, newborns, and their families through research, education, and advocacy. And AWHONN's vision is making a difference in the lives of women and newborns. Our members are committed to the health of women and newborns. So I just wanted to give you a little bit of background about the agency, the nationwide association that developed this educational program. Next slide. So AWHONN's research and quality improvement efforts identified that nurses were often unaware of the leading causes of maternal mortality, such as cardiac disease, hemorrhage, venous thromboembolism, hypertension disorders, and infection. And that nurses also lacked, their lack of knowledge can significantly limit their ability to properly educate women prior to discharge on the signs and symptoms of complications associated with these causes of maternal mortality. Next slide. So we looked at AWHONN's post-birth warning signs as a way to try to address the fact that 56% of our maternal deaths were in that postpartum period, occurring after the birth of the baby and after discharge from the hospital. So what we are going to do is National AWHONN will provide education and toolkits to at least 10 nurses from each of Iowa's birthing hospitals. And then to reinforce that education that is provided in the hospital, 50 RNs working for our Title V maternal health community-based programs will also be provided the education. Oftentimes the mom in that immediate postpartum discharge, when she's getting that education in the hospital, she's really focused on the education about how to take care of her baby, and often kind of overlooks or doesn't really listen carefully to the information provided to women on their own care. And there's been some studies that have been done showing that just overall that discharge education is not often remembered by the mom. There are ways that we can help improve that. And one way is to have community-based programs reinforce the education that the nursing hospital nurses provide. The nurses also, in addition to the online learning, get a toolkit to help them. The toolkit includes additional references that help show the evidence behind the training. Handouts for the mom called Save Your Life handouts that are available in different languages. An education checklist. And audit logs to track implementation and sample hospital protocols. Next slide. And this is the AWHONN's post-birth warning signs handout that helps educate and empower women to understand potential life-threatening emergencies and know when to call 911 or their healthcare provider. And it does include the risks that were most likely to cause death in our maternal mortality review committee, and also nationwide. They've done studies looking at many other review committees' results, and this education does include cardiac disease, pulmonary embolism, venous thromboembolisms or blood clots in the mom's legs, hypertension, hemorrhage, sepsis, and postpartum depression. And I'm going to turn it over now to Dr. Radke.
Thank you. So it's important to think about, first, why is it important to standardize discharge education across patients and facilities? We do have evidence across many fields within healthcare that standardization of care is associated with improved outcomes. Care standardization improves the quality of information and the education that's provided, and it also ensures that there's consistency in education delivered. We know that complications can happen in the postpartum time period, even to women who would be perceived to be low risk and don't carry any recognized high risk factors. So it is really important that all postpartum people are educated as to the warning signs, not just those who are deemed to be higher risk. Additionally, it's really critical that both patients and their families are aware of the process of contacting their healthcare providers and hospitals, which symptoms would constitute a need to call 911. These discharge standardized instructions provide clear indication for that. Finally, there are studies that show that standardization of care around education is shown to improve the satisfaction on the part of the patient. Additionally, one area of concern in our state and across the country is around healthcare disparities, and specifically racial, ethnic, and socioeconomic disparities experienced by the birthing population. We consider that standardization of care has the possibility of improving equity and reducing disparities. When healthcare providers are left to utilize their own judgment about who requires what education the patient will understand or might be pertinent to them, this is an opportunity for implicit bias to influence these decisions. Bias may lead to non-English speaking or other disadvantaged groups receiving postpartum education that is not culturally congruent for them or relayed in a manner that's understood, including potentially not even in their own language. Standardizing this education helps ensure that plain language information that has been validated and is at an appropriate reading level is relayed, and it ensures that all the patients receive appropriate education prior to hospital discharge. And we hope this will reduce Iowa's postpartum maternal mortality as well as the disparities that we have in our state. In order to support this, AWHONN does have their Save Their Life handouts available in multiple languages, including English, Spanish, Arabic, and Mandarin Chinese, with new languages and regional dialects coming on board as we move forward in time. So our implementation plans, to summarize, are that each birthing hospital and Title V public health agency has a coordinator who will monitor online training for the participants of their facility. There are implementation tools included in the toolkit, so the teams will all have the skills necessary to incorporate this into their routine practice. The hospitals are encouraged and supported to incorporate the education into their electronic health record, including a checklist to ensure that all parts of the education are covered with each family before discharge. Finally, the toolkit does include audit packages, so each facility can monitor uptake of the program and ensure that it is being implemented as it was intended. Some of our next steps for this project, which is underway, are that first we want to monitor the success of our implementation stage. We will be looking for our hospitals and Title V agencies to report back to us as their providers have completed their training and as they have begun to implement this in their institution. We would like to review their audits to ensure that this has been effectively implemented, and we can offer support if there's trouble moving this into standard practice. The next step for us following that is to think about how can we monitor the impact that this may be having on patient care. Currently, as many of you in the audience are aware, we monitor maternal morbidity primarily by experience of morbidity that happens during the same hospitalization as the delivery occurs. And so we don't currently have a standardized way to capture in events that might occur after hospital discharge. But our team here in Iowa is working with our MCH epidemiologists to consider innovative ways that we may be able to capture this information moving forward, such as examining emergency room visits among women who have given birth within the prior 30 days, as well as hospital readmission rates. And so plans are underway in this area. And finally, we plan to monitor our ultimate outcome regarding maternal mortality in the postpartum time period. We will continue to monitor the number of cases that we have, as well as the types of underlying causes and contributing factors, as well as the preventability. Thank you so much for listening to our session. Please do not hesitate to reach out to us at our email addresses here on the screen if you have any questions about our program. Thank you.